Let's talk about something a lot of us notice but rarely discuss. Varicose veins. You know, those swollen, blue, twisted veins that sometimes show up on your legs? They might look harmless, but for many they bring heaviness, swelling, aching pain, and even itching. In severe cases, you can get skin changes and sometimes ulcers. So what's actually happening here? Well, inside your veins you've got little valves that keep blood moving up toward your heart. But when those valves stop working the way they should, blood starts to pool. That's when varicose veins pop up. Now, if you've got varicose veins, there are quite a few treatment options to consider. For starters, simple lifestyle tweaks can make a big difference. Things like regular exercise, putting your feet up when you can, keeping your weight in check, and not standing still for too long. Compression stockings are another go-to. They squeeze your legs just enough to help your blood flow. For smaller veins, doctors sometimes use a technique called sclerotherapy, where they inject a solution right into the vein. Surgery used to be common, but it's not the first line anymore. These days, minimally invasive treatments like Endovenous Laser Ablation or EVLA have become the gold standard. So, what's EVLA all about? Let me walk you through it step by step. Before anything happens, you'll get a special ultrasound scan, called a venous duplex, to map out exactly which veins need attention. Your doctor will go over everything with you and answer your questions. If you're on blood thinners, you might be asked to pause them for a little while, always under your doctor's advice. On the day of your procedure, you'll lie down comfortably. The area is cleaned and numbed so you won't feel pain. Using a tiny needle, a laser fiber is gently threaded into the problem vein. Ultrasound helps guide every move, making the process super safe and precise. Now here's the cool part. Local anesthetic fluid is placed around the vein to protect everything nearby. Then the laser is switched on. It heats up the inside of the vein, sealing it shut as the fiber is slowly pulled out. No stitches needed, just a small bandage when you're done. Afterwards, you can walk right away, which is honestly pretty amazing. You'll probably wear compression stockings for about 2 weeks and you might feel a bit of bruising or tightness, but that fades pretty quickly. Most people are back to their regular routine in a day or two. And you'll usually have a follow-up ultrasound to make sure everything's closed up as planned. So, here's the takeaway. Endovenous laser ablation is safe, effective, and minimally invasive way to treat varicose veins. It relieves symptoms, improves the look of your legs, and helps prevent serious complications down the road. Quick recovery, big relief. You really can get back to living your life almost right away.